Welcome to Friday Friends, RI Elder Info's weekly look at the organizations and individuals providing resources for Rhode Island seniors, caregivers, and professionals.
Good morning, everyone. Happy Friday. It is 9 a.m. on Friday, so you know what this is. This is our weekly Friday Friends show. I am Deb Burton, the Executive Director of RI Elder Info and creator of rielderinfo.com. We maintain the most comprehensive resources for seniors, caregivers, and professionals. But I think you already knew that. That's why you're watching, and that's why you've checked out rielderinfo.com. So we are a 501c3 nonprofit, and we get by with a little help from our friends. So a big shout out to our sponsors and our donors. Thank you to Oak Street Health. They've got different locations for primary care, comprehensive primary care from around the state. Also, United Healthcare, they're an amazing Medicare provider for those individuals who are Medicare eligible. And we also have Tamarisk Assisted Living, a little homey feel assisted living facility right over in Warwick by the mall, as well as 321 Media, creating the magic that you're seeing here today. And England Studio, the creator and the web designer of rielderinfo.com, because I know a lot of things, but I don't know web design. And we would like to also give a big thank you to our sponsor for this month, to the Ocean State Center for Independent Living. Let me give you a brief message from our sponsor. Thank you.
Do you have a disability and want to be more independent in your home and community? Do you experience barriers that keep you from living life on your own terms? Ocean State Center for Independent Living in Warwick is there to help. Call 738-1013 or visit their website at oscil.org to learn how they can assist you. Ocean State Center for Independent Living is Rhode Island's go-to organization for disability services, resources, and information. Visit their website at oscil.org and begin living your life on your terms.
They're a great program. I encourage you to check it out. So this week we're going to talk about something called person-centered dementia care. And I know you might be wondering, what is it? Why do I care? And how is it done? So I would like to bring up Laurie Mantz of Dementia Training for Life. Welcome, Laurie.
Good morning. Happy Friday.
Happy Friday. So there's this new buzzword going around called person-centered dementia care. What is it, and why should anybody look into it? Is it something that families ask for something to be done with their loved one? Can you share what that is?
Sure. Well, let me add one correction there. It's not new. It's been around. It's actually been the root of my education some 40 years ago in occupational therapy, where we adapt whatever our approach is to meet the very specific needs and interests of each individual. So even though you may have, and in the world of dementia, you may have two people with Alzheimer's, those two people are very, very different. So unlike other methodology in medicine, if you have a, let me say, an upper respiratory infection, there might be a very specific way that you manage it. That's not the case with dementia. In dementia, what we have to do is we have to understand, first of all, what disease is causing their cognitive loss. And that's the important thing that people have to understand is dementia is not a disease. Dementia is the result of a variety of different diseases that affect the brain.
So is dementia Alzheimer's? Isn't anybody who has dementia, is it Alzheimer's?
It could be, and it could be other things. So let me explain it this way. If I had a runny nose, a scratchy throat, and a cough, what do I have?
COVID?
Could be. Or
it could be a cold. It could be allergies.
And all of those things you're going to treat differently. But the symptoms, the runny nose, the scratchy throat, and the cough is what you see. In dementia, it's the symptoms that you see. So you see the loss of memory, you see the confusion, you see the loss in function. That's not the disease. That's the result of the disease. So
Okay.
Alzheimer's is the most commonly diagnosed. But we now know that a lot of people are misdiagnosed because there are over 120 different diseases that can cause dementia.
Wow. That's
Yeah.
a lot of different things that can cause dementia.
And there are things that look like dementia that actually can be treated. So that's why it's so important when we start to see problems with memory and start to see confusion that we get people to their doctors to find out, do they have a metabolic disorder? Do they have a endocrine issue? Do they have a hearing loss? Are they dealing with Lyme disease? And these things are all treatable, and we can actually reverse the cognitive loss. So it's
Wow.
really important. It's not the loss of cognitive function is not a normal process in aging.
Wow.
That's the
So,
most, go
can
ahead.
you just go back real quick for because it's so common here in Rhode Island, Lyme disease.
Mhm.
The damage Lyme disease can do for like memory, that's reversible?
If it's treated properly, yes.
Wow. Wow, that's awesome. I did not know that.
Yes. There are some very famous people that were diagnosed with different conditions that result in permanent brain disorders and later found out it was Lyme disease. And when they were properly treated, they regained their cognitive function.
Awesome. So what is this? So what is person-centered dementia care? How is it done? Is it something that if my loved one is in a long-term care setting that I should ask them to do, or is it something I do for them? Is it something I do at home? How does this work?
Yes, yes, and yes.
I like those questions.
So, person-centered care is adapting your behavior and adapting the methods that you use in order to meet the needs, wants, and interests of the individual that is dealing with the dementia. So, I started before saying you have two people with Alzheimer's. Well, you have a man and a woman. Okay, so what did the man do for a lifetime? He was a mechanic.
Mhm.
Excuse me. What did the woman do for a lifetime? Well, she was a homemaker. Things that you're going to present to them for activities and interests are going to be totally different. But they're also going to be totally different if he speaks Spanish and she speaks English.
Yep.
They're also going to be very different if she's sustained a trauma during life where she was assaulted and he wasn't. So the way you provide your personal care is going to be different. You need to understand that the person that is sitting in front of you is the result of a lifetime of events and activities and experiences. And all of those are stored in their brain and in their soul. So all of those have to be tapped into in order to reach that individual, even though they may not remember or say they don't remember who you are at that moment. They certainly remember in who they are, the experiences that they've gone through with you. So it's important to recognize that depending on where someone is in their disease process, and it's a neurodegenerative progressive disease that unfortunately is fatal. But there's a lot that we can do in the meantime to improve quality of life and function while we're adapting to those changes.
What are some of those things that could be done? Like, can you give me some examples of what person-centered care could look like other than a man versus a woman? Like, how in depth is it important to understand what that person's background is?
Excuse me, I have a tickle this morning.
Spring allergies are starting.
Oh, yeah, definitely. So say if you have two women,
Mhm.
one worked outside of the house and worked as a secretary, and the other one was a homemaker and took care of five children. the activities that are important to them and will give them purpose and will engage them are very, very different. I'm assuming, and that's a bad thing to be doing with person-centered care, because you need to know the person that you're dealing with. So you really need to know their history. But the person that worked as a secretary all her life, she would be really comfortable helping organize paperwork and putting things together, and maybe even organizing her home. But things that are important to her versus the person who stayed at home and took care of her children, that maybe it's cooking or it's providing childcare with support and supervision, or engaging with reading activities. That's one of the things that we know, that people with Alzheimer's and other diseases that cause dementia don't forget how to read. They forget what they read. So if you put something in front of somebody, if they were a reader before, they may very well still be able to read. May not be able to read a book because they can't remember what they read the day before, but something right in front of them. So it's a way to engage them with the younger generations.
Okay.
So it's important to tap into their past life experiences to bring out who that person is. Deb, have you ever seen the commercials where they show the elderly person in front of a mirror? And in the mirror, they show them dressed in the uniforms of the jobs that they might have done at a younger age.
Yes, the nurse and the veteran and the mechanic. Yes.
That's who we're taking care of. We're not taking care of an 85-year-old woman who's losing her skills. We're taking care of that nurse. And we have to get into her world as it existed then, because her brain is now functioning back at that level. And it's really important that we gather the essence of the individual as opposed to center in on their current capabilities.
Okay. It's very interesting because I feel like we don't necessarily change as we get older. It's the outside world's perception of us. So, I'm still a 20 something. I just happen to be locked in a much older body now.
Yeah, I noticed that yesterday with my new headshots.
Yeah, the spirit is still there. You still want to engage in lots of fun, different things. I notice some days when, storm coming like tomorrow, some of my joints don't move as well as they used to, but I still make the modifications necessary and go on. So, is this something that individuals who work in long-term care, is this something that they're familiar with? I know that there's a whole lot of talk on the workforce shortage and staffing crisis and all that kind of thing. So if you had to work with a lot of people in a short amount of time, what's the best way to really honor each individual, who they are as a person when they have dementia, but you have a lot of people to take care of?
Well, if you have one-on-one time with them as opposed to in a group, first and foremost, know the name that they like to be called. My grandfather's given name was Cecil, but
Yep.
you never ever called him Cecil. You called him
Yep.
CJ.
Yep.
Cecil would raise the hair on the back of his neck. So it's really important that you know what their chosen name is and use it, not using Hun and Missy. And some people will respond to sir or ma'am or miss, but that still is impersonal. So really know who you're working with. When working in a group, sometimes what you have, and I'm talking about multiple people in one room, you have to find a common denominator, and finding something that is common to all of them. And that's not easy. It is not easy. But I can tell you the one thing that tends to really spark a common denominator is music. And
Really?
music, oh my gracious, yes. I can tell you the first song that I did a slow dance to in 6th grade. Um, and it stays deep in the brain, in the amygdala, which is a part of the brain that isn't affected by Alzheimer's disease specifically, and is emotionally rooted. So people can tell different songs that were really important to them. So it's important that we tap into the things that are common among people. So, but you've got to work with the people that you're working with to find out what do they enjoy doing. But please recognize that they like to learn new things. They can learn.
They can still learn. Even though you have dementia and you can't retain knowledge, you can still learn.
Yes, you can. You can learn new skills and new tasks through repetition and having consistent programming, and your environment is set up the same. And it takes some time, but they can learn. But they can also enjoy things that they've never ever done before. I had a gentleman that I worked with, brilliant man, who had to start his day every day with the New York Times. Now, here's the situation where he could still read, but he didn't remember what he read. But he knew his morning had to start with the New York Times. And then he walked all day and couldn't sit still. Well, we had an artist come in and introduce a painting activity. That gentleman sat and painted for 2 hours and
Wow.
had never picked up a paintbrush before
Wow.
and found a new passion. And I've seen that happen over and over and over again. So just because someone has never done something doesn't mean they might not enjoy it. And
So is it possible that as the disease progresses, the things that someone maybe didn't enjoy that they might now enjoy, and
yeah,
family could be, I would imagine family if could be kind of confused. So um, it's not a particularly great secret that I don't enjoy cooking and I'm not good at it. And then those two things go together. Um, Smoke detector is usually when I know dinner is done. So is it possible if I develop dementia that over time I might actually enjoy cooking?
yeah.
Wow. That's amazing. And I have to say that would be really confusing for a lot of people who know me.
I can't say that you would be good at it, Deb, but I can say you might enjoy it. But with support and with guidance and in a social gathering, which socialization is so crucial to our brain. If we haven't learned that in the last 2 years with COVID, it is so crucial to brain function. So there are studies after studies that have shown that isolation and loneliness has a significant impact on brain function.
And we're seeing a lot of that from
Yes.
COVID. And yeah, it's definitely escalated with COVID.
Yeah.
So I would imagine then that makes engaging with folks even more important.
Yep. Absolutely. On their level and what they're capable of doing at that point in time. It's really important to present an activity, an engagement, an interaction at the level that they can comprehend. So I am in no way saying that our elders are like children, but you would present an activity to a 3-year-old that is very different than you would present to a 5-year-old, that you would present to a 7-year-old.
Yep.
We lose our cognitive function in the absolute inverse of how we gain them. So the way we developed from childhood to young adulthood, we lose those skills in the absolute inverse. So those higher level cognitive skills are the first ones to go, and those lower level cognitive skills are the last to go. So tap into the skills that are still there. And as an occupational therapist, we can help you. We can tap into home care that can help us really delve into what is that person's capability at this time. And as you know, if you presented an activity to a 7-year-old that really was appropriate for a 3-year-old, they're going to get up frustrated and upset. It's like, why the heck do I want to be doing this? And the other is true, that if you presented a 7-year-old activity to a 3-year-old, they're going to get frustrated and upset. So if you present something to someone that is much higher functioning, like they used to do 3 or 4 years ago, that they can't do now, they're going to get frustrated and upset. And that may come out as behavior. So when you see people's behavior change, they're communicating to you their wants and needs. Something's happening, whether they're acting positively or negatively, but something's happening that's affecting the way they feel. And that's the way that they can express it. Because sometimes for people with various different dementias, they can't communicate the way they used to.
Wow. So something has come up. Say, for instance, Dad always did like woodworking, so he would like build birdhouses and things like that in his spare time. Like he really enjoyed it.
Mm-hmm.
But it seems like sometimes he can do it,
Mm-hmm.
and then other times he can't. So if somebody is just like, Dad, like, how to do this, like, just do it. Like, what do you mean you need help getting, the drill to align with the head of the screw? Like, how do caregivers deal with that situation where yesterday they could, today they can't? How do you deal with that kind of frustration where it's like, you just did this, and you've done this your whole life? Like, what can caregivers do? Because that can be really frustrating, and it's like, are they just playing with me? Like, are they pretending not to know?
No, they're not. And the very, very first thing that you need to do is take a deep breath, because it's not about you. It's about them. And they recognize that they can't do it. So you know that they're feeling frustrated too. But for some reason, that part of their brain is just not firing. And we have to remember that all of these diseases that cause dementia are brain diseases that are impairing the brain function. And actually, in some cases, the brain is shrinking. So there's less brain tissue. So for some reason today, that area of the brain's just not firing. It might fire tomorrow. It might fire later.
So it can come back sometimes, which only kind of makes it seem like maybe the person with dementia is kind of faking it. Is
messing with you? Yeah, definitely. No, it's just that the brain isn't working.
It's having a hiccup kind of day.
Yeah, exactly.
Yeah. So we've had folks on the show who have discussed, a lot of times we get nervous when we're older, that we're forgetting things. And they pointed out, you don't think, but you start getting worried that it's dementia because you're older. But nobody in society ever questions the teenagers who forget stuff. So, I think how important is having that proper diagnosis to be able to provide person-centered dementia care?
I can't express how important that is, because the way that you're going to interact with somebody that has Alzheimer's versus somebody that has Lewy body disease, which is the second most commonly diagnosed condition that can cause dementia, is very, very different. And understanding how they're reacting to their disease. One of I'm going to take a side step here for a second. One of the ways that I like to look at this is that it's a lot like paralysis. So if you have somebody that has paralysis, well, what does that mean? Well, for some people, it might mean that they have weakness on one side of their body. The other person, it might be that they have weakness from the middle of their body down. Maybe that they don't have any mobility. It's all different, but it's all called the same thing.
Got it.
And dementia is all called the same thing, but it's all very, very different as to how it's affecting the individual.
So if I'm understanding, there's different dementias which cause different behaviors.
Mm-hmm.
The person is still inside.
Mm-hmm.
And regardless of what those behaviors are, it's really important to be able to find that person and the things that they've enjoyed,
Mm-hmm.
so that then going backwards, you understand the behaviors that they're doing to try to communicate.
And that allows you to maybe avoid some behaviors. So if you know that every time that you're presenting a meal in front of somebody and they say they don't want to eat or they don't start eating, it may be that you're presenting a white plate on top of a white tablecloth and they can't see it. So you have to adapt your environment. So just changing the placemat cover, or handing them the fork, and all of a sudden the fork in their hand gets them going so they can actually start eating again. Initiating tasks can often be very difficult for people with different forms of dementia. So again, it's knowing your person. What's hard for them and how do we adapt in order to make it easier for them?
You know, that white on white analogy, I was thinking how that is sometimes an issue in the bathroom because it's the white toilet seat with the white bowl, and there's no contrast with the white tub and the white sink.
And the
And
white floor and the white walls.
yeah, yeah.
Absolutely. There has been,
I'm not sorry, folks. I know this is like a breakfast show.
but there is great research out there that says just put a different colored toilet seat on the toilet and you will increase someone's independence and reduce falls
Wow.
because they can see the contrast.
And that's also person-centered dementia care.
Yes, because you're adapting to meet their needs.
Very cool. Very cool. It sounds like there's a wide variety of things that people can do. And I would say it would be smart that if your loved one is in a facility, to maybe take those steps to educate the facility about your loved one. But maybe the inverse is true too. You know, if I am in a facility one day and all of a sudden I am in that facility's, kitchen cooking up a storm, recognize that maybe something changed in my brain and suddenly I love cooking as a part of the dementia process.
Mm-hmm. Mm-hmm. Yeah.
Yeah. And accept what the staff is telling you, that your loved one has changed.
Absolutely. Absolutely. We all change.
Yep.
We all, and just because even foods, I mean, that's a big change for some people that, they always like to eat XYZ, but now they won't eat it. Well, unfortunately, one of the things that happens is that our taste receptors change and our perception of what something tastes like changes. So the last thing for the last sense of taste to go is sweet. So you may see somebody piling salt on their food to try and get some taste to it, but they can't perceive it. So they don't like that hamburger anymore, or they don't like that fried chicken anymore because they can't taste it. And think about what it's like when you're really, really sick and you're all congested and you can't taste food. Do you want to eat?
Not really.
And that's what's happening to them. So that's when you have to try and find what works.
Wow. This has been great today, really talking about the details of what the person-centered dementia care is, Laurie. This has been awesome.
Oh, well, thank you. And it's my pleasure. And the most important thing is that we realize that every person's different.
Yeah, we all are. Absolutely. And I'm fairly certain I'm never going to like liver and onions. I might shock people and love to cook one day.
Mm-hmm.
And maybe, we'll have a conversation about what we can do ahead of time to kind of stay healthy and maybe prevent dementia, at least of some sorts. And that'll be a conversation for a different day.
Yes, but there's some great research out there that says that we can maintain a healthy brain through our own activities. So that's real important too.
Oh, that'll be a conversation for a different day. Absolutely. Laurie, this has been great. Thank you so much for coming on. And if people have questions, can they reach out to you?
Absolutely. So they can reach me at Laurie at Dementia Training, 4 life.com, or they can go to my website and get more information about it. Thank you very much. There's my email address. And certainly can reach out to me. And I'm also involved in a new grant that's going to be bringing some evidence-based programs to the community, which I'm really, really excited about, that have proven to improve quality of life and function for individuals living with dementia. So
more to come.
More to come. Absolutely.
That is awesome. Thank you so much for coming on today, Laurie. I really appreciate it.
My absolute pleasure, Deb, as always.
Thank you. So a lot of great stuff we talked about, maybe not always appropriate for the breakfast hour, but still information that's really important for people to understand. So I really hope that you have hit the like button and the share button and the bells and, all those things that are saying, yes, I want to see more information as things go forward on how to remain independent and help my loved ones be independent as we age. One of the things that Laurie had mentioned is Lewy body dementia is the second leading cause of dementia. And I'm happy to say that we will be having the Lewy Body Dementia Association on in a couple of weeks. So you want to hit the like and the follow and all those things so that you don't miss that opportunity. So I'm glad that you were able to join me today. I'm very grateful for our sponsors. Thank you to Ocean State Center for Independent Living. They can help with home modifications for your loved one. So that different colored toilet seat, that might be something that they could help you get installed. It's the little things like that that can make all the difference in the world. Now, don't forget, on Sunday, spring forward, change your clocks because you don't want to be late to Friday Friends next week. I look forward to seeing you all. And in the meantime, be well and be kind.
If you liked this video, please follow us on social media and subscribe on YouTube. For more information, visit rielderinfo.com or call 401-585-0509. If you have any questions, email deb@rielderinfo.com.